everyone, and welcome to my YouTube channel. My name is Dr. Romaila, and today I have a very special guest with me. Her name is Divya.
Hi everyone, very nice to meet you.
And she's here with me because we are going to be discussing very exciting topics, things that your doctor commonly tells you at every visit or some of your visits, and why they're important and what's the reasoning behind it. So the first thing we're going to talk about is a very important one, which is you should not give your baby honey if they are less than 12 months of age. What do you think about that, and why do doctors recommend that?
So that's a very good question because even now, many beliefs and cultural practices are going on where they feed raw honey to babies within like even less than 6 months.
Yeah.
So now I'll tell you why it is bad. So raw honey contains something called spores, which is a very common bacteria called Clostridium. This bacteria, what happens when taken by the baby, it goes into their very underdeveloped digestive tract where the spores can release some toxins and it can go and affect the nerve cells,
Yeah.
which eventually leads to poor feeding, constipation, and even paralysis,
Yeah.
which can be really harmful for the baby.
Yeah.
So this is why I recommend not to give raw honey to the babies.
Yeah.
And the most important treatment would that be, as soon as you notice these symptoms, go to your closest healthcare provider and they will give you an antitoxin which can save your baby and their life.
Yeah, so do not give raw honey to your baby.
So Dr. Romaila comes to my next question as I wanted to ask you.
Yeah.
They say no amount of alcohol is recommended for
Yeah.
anyone, right?
Mhm.
But still, in some practices, they think drinking a glass of red wine is healthy for you, and why not? Like even me, sometimes I think red wine is useful. So, what do you think about it?
So it's basically the cumulative effect of the red wine, which is dangerous. Nobody stops at just one glass of red wine. And if you drink a glass of red wine every night with every meal, that can accumulate over time. Some research has shown that if you drink a glass of red wine here and there with your meals, it can improve your cardiovascular health. But there's a lot of confounding bias with that. And by that, what I mean is that it also depends on a lot of things. For example, high socioeconomic people have access to better alcohol. Apart from that, there's a lot of other comorbidities. For example, if you're obese already, if you have any hepatic illness, for example, chronic hepatitis C or chronic hepatitis B, that can affect your liver already. And on top of that, if you're drinking red wine on a daily basis, it can damage the already damaged liver and the already damaged systems of your body. So a lot of things play a part in that, and that's why it's recommended to not drink alcohol at all, because there's no safe limit to alcohol when you take the bigger scheme of things into play. That's why if you are not drinking, don't start, and if you already are drinking, then you should tremendously cut down on your drinking habits.
I see. So, I think it's time for me to stop. I mean, that would be the best.
I hope so. Okay, my other question to you is that every doctor that I go to, they always tell me you should put on sunscreen, you should put on sunscreen, and that's a general recommendation by most doctors to all of their patients. Why do you think that is?
Yeah, so this is a very well asked topic, the sunscreen topic in general, because many people think it's like, just a superficial application. How is it going to protect you?
Yeah.
So let me talk more about it. So, sunscreens, first, let's see how much to use and when to use, right? So, outdoor activities is something that we all love during the summer months.
Yeah.
So, let's say whenever you have to go to outdoor activities, the recommended amount is from 1 to 1.5 ounces of sunscreen with SPF 30 or higher, right? Applied every 2 hours.
Yeah.
Now, let's say, what is this SPF? Like,
Yeah.
why is it so important and what to look for in a sunscreen pack that we use? SPF is something called the sun protective factor, and it contains the filters UVB and UVA1. So let's say what is UVB and UVA1, right? UVB is called ultraviolet factor B. This is the one that protects you from the ultraviolet rays. That is, it helps you from absorbing that rays so that it doesn't penetrate your skin, right? And the higher the SPF, it goes linear with the percentage of ultraviolet rays absorbed. Like, for example, an SPF of 30 absorbed about 96%, and SPF of 50 absorbs around 98%.
That's very interesting.
Yes, and I wouldn't recommend below SPF 30 to be used.
Yeah.
Right? And what is UVA? UVA is something that protects you from photo-aging signs. And UVB is something that protects you from moles, freckles, and also carcinogens.
Yeah, that's very important.
It's very important to use it. And why every 2 hours? It's because all the skincare products that we apply gets absorbed by our skin. It's not usually there as a physical penetration. So applying every 2 hours helps you from protecting the physical penetration, right? And do not use sunscreen for babies less than 6 months because their skin is still very fragile and it cannot withstand that strong of chemicals on it. So usually use physical covering for them, like clothing and keeping them in the shade. But other than that, everybody above 6 months, please do use sunscreen.
It's very important.
Yes.
Yeah.
So let's go a little bit about the physical activity that we are using, because we spoke about outdoor activities, right? So whenever I went for my physical checkup to a doctor, they said do 150 minutes of exercise per week.
Yeah.
Why is this number 150 so important?
So basically 150 minutes of exercise has shown a lot of benefits, and that is the baseline at which we recommend people start. It can go up and it can go down depending on your day-to-day life and your day-to-day activities, and it basically allows you to integrate that amount of workout at least in a week for most people, because lives are busy and not everyone can incorporate vigorous exercise into their daily lives, right? So 150 minutes is a good amount of time for exercise, which can help you see the benefits and reap the benefits of that exercise. You will see a lot of cardiovascular health benefits, which means your heart and your vessels are going to be strong. Apart from that, you will also see benefits for your weight. You will maintain a healthy weight, which will prevent you from getting obese and getting those comorbidities associated with obesity. Apart from that, it's also excellent for your mental health, because our body releases endorphins and a lot of happy chemicals whenever we go for a walk and see nature and see people and animals and whatnot, and that actually gives us a lot of releases a lot of those endorphins in our body, and it's actually amazing for us. Apart from that, muscle strength and bone strength is a big one. Exercising can actually help strengthen our bones and our muscles, and it can show a lot of long-term benefits for our body and our health. And 150 minutes is just the baseline that everyone should try to incorporate in their day-to-day life. Even so, if your life is busy, 150 minutes is something that you need to prioritize for your own health.
So I think it's time for me to go shop those Skechers.
Yes, you do. Okay, now moving forward, I want to know a little bit about marijuana. Marijuana is a big one in Canada because it is legal here, and a lot of people use marijuana and they don't realize a lot of the side effects associated with it, because they think that, oh, it's better than cigarette and it's legal and it's fine and it's just, it's nothing. I want you to tell the audience a little bit about the side effects of marijuana and what it can cause long term.
There are two types of marijuana usage, right? There is one medical use and there is one recreational use.
Yeah.
So first, let me give you a brief about the medical use. It is mainly used in cancer patients to decrease their signs of nausea and other kinds of chronic pain, and even in seizure disorders. So why is it used in medical use? First of all, it's because these medical use are made in pill forms or syrup forms or even smoked forms, but they are highly formulated and balanced, and they're approved by the authorities, suppose for example the FDA, and they're legal to use because they're very highly less concentrated of the THC, the cannabis, and they can be healthily used. Now let's go into the recreational use of drugs. The recreational use of drugs contains up to 90% of the THC cannabis, which is like really high, and not so well controlled, and people smoke it up or they use bong forms, and it's not really regulated. Now, let's talk about the consequences of using marijuana. People think it doesn't contain nicotine, it's better than cigarettes. Let's see how it does. First of all, the highest rate of deaths because of marijuana can be because of accidents, suicides because it causes disorders like schizophrenia, acute psychosis, and it is highly used in people with ADHD. Did you know about it?
I did not.
Yeah. 40% of people with ADHD go for usage of marijuana because they think it reduces their function and reduces the activity.
Yeah.
But they don't understand that it leads to consequences like acute psychosis.
Yeah.
So, and people use it for weight loss as well. But it doesn't, there are no reports that shows that marijuana is used for weight loss.
Yeah, I feel like on the contrary, I feel like marijuana is not an appetite suppressant.
It is not.
Yeah, marijuana increases your appetite instead of decreasing it.
Correct.
Correct?
Correct.
Yeah.
So what it does, it goes to a certain part of your brain, which is called the basal ganglia and the hippocampus. They have cannabis receptors.
Yeah.
They don't directly stimulate the hunger centers in your brain, but they indirectly inhibit the hormones. Right? For example, it inhibits something called GABA, which is GABA is a natural inhibitor of many of your hormones in your body. It inhibits the inhibitors. So which means the other hormones are secreted in excess. Right? which can be the happy hormones, sad hormones, hunger hormones.
Yeah.
Everything is secreted in excess. So
Mhm.
you have no control over anything.
Yeah.
So I would really recommend, please don't use marijuana on a long-term basis. But I would say even on short-term basis, because addiction is one of the crucial steps
Yeah,
that goes about
because
it.
like you mentioned that you do lose control, because I've seen a lot of patients that become very gloomy on
Correct.
marijuana, and some patients become overly happy on marijuana.
Exactly,
So it does throw everything out of balance in a way.
Absolutely.
Right?
Absolutely.
Yeah.
So just don't go for it at any point.
Mm-hmm.
So, Dr. Romaila, let's go into this one.
Mhm.
So, I have seen many doctors say don't use antibiotics
Yeah.
on a regular basis, only use as prescribed. Can you tell us more about it?
So, this is a very good question. And the reason why doctors say not to use antibiotics for anything and everything, there's a very good reason behind it. And I've seen people popping antibiotics like it's nobody's business. In parts of the world where antibiotics is widely available over the counter, even if you have a little bit of a flu, everyone's going out to the pharmacy getting antibiotics and popping it, not thinking about the dosages and at what times they should be taking it. And what's important about that is that as time passes by, every dose of antibiotic you take, the bacteria within your system become stronger and stronger. They become more and more resistant to the antibiotics. So when an actual disease comes upon you, which is a strong bacteria, your antibiotic usage will not work against it, because the antibiotic will already have been used for the weaker ones, and the weaker ones even will become stronger. So it does not help in the long term. So it's very important that you reserve those antibiotics for times of actual imminent disease, and when you actually think it's necessary, so that your body does not become resistant to different strains of bacteria. And there's one more thing that's very important. When we take an antibiotic, it not only affects the bad bacteria, the ones that are causing a disease or illness, but it also affects the good bacteria. For example, we have good bacteria in our gut, and that is keeping everything in balance, and that is digesting the food and doing everything how our digestive system is supposed to work. But when we take the antibiotic, what happens is it gets rid of, or it destroys the good bacteria as well. And then our gut can be out of balance, and it can cause different issues related to the gut, like diarrhea, constipation, even skin issues. That's why a lot of people have flare-ups of eczema as well whenever they take antibiotics. And whenever most of people take antibiotics, they usually get diarrhea as well, and that's one of the causes of it. So that's why it's very important to not just take antibiotic for everything and anything.
Correct.
Yeah.
And just to add on to this, even if you have to take antibiotics, please do take probiotics with it.
That's true.
To replenish the good bacteria, right?
Yeah, yeah. My next question for you would be, why does a doctor tell parents of a newborn or a baby that it's very bad for them if there is secondhand smoke involved in the house? What's some of the reasoning behind it?
Okay, so it's not a hidden fact that any kind of cigarette smoking or other forms of smoking, the first organ that affected is lungs, right?
Of course.
When we ourselves as adults can affect our lungs, so imagine an immature lung of a baby, what could it lead to?
Yeah.
Right? So secondhand exposure is most commonly seen in people whose mother or father in the house is smoke.
Mm-hmm.
Correct? When the baby is just there lying around, when the mother smokes and involuntarily the baby is inhaling the smoke, it's called secondhand exposure. And highest number of babies are known to die in their sleep. This is called sudden infant death syndrome.
Mm-hmm.
And the highest amount of babies die because of this, because they inhale the smoke and this smoke goes into their immature lungs, and this cannot be neutralized or balanced by the body, and this leads to sudden infant death syndrome. And how does this happen? So let's go a little bit into the process of it, okay? So when the baby inhales the smoke, we know that the smoke contains a lot of tar, nicotine, and all these chemicals. Nicotine, when it's metabolized, it leads to something called cotibine. Okay? This cotibine chemical, our own adult bodies and lungs doesn't neutralize it, right? Imagine the baby, when it just accumulates this chemical, it cannot work or function anymore. And the baby just die in their sleep. And it can happen as sudden as possible, and the parents won't even know the reason. Okay? And then, as the secondhand exposure is not that much, like in quantity, but slow exposure can lead to something called respiratory inflammation. This can lead to increased infections in babies. Asthma. Asthma is something that is highly seen in babies with secondhand exposure. So smoking in general is not recommended for anyone. Like, I'm so against it. But in case you're doing it, even just please go out at a very high amount of distance and then smoke and do come back closer to your baby, not anywhere around your baby.
And even if you do, when you do come back, you need to wash your hands thoroughly.
Absolutely.
You need to change your clothes. You need to wash your face. You need to,
just
a
basic
person.
We know different babies are different. Some babies will have developed lungs, some people won't have developed lungs. So just stay away from all the risks.
Of course.
Since we're talking about the babies and the secondhand exposure, Dr. Romaila, I have a very unique question for you, if I can say, which is increasingly used in today's population. I have been noticing people using baby walkers or jumpers. What do you have to tell about that?
I think that it's not good at all. Should not
that's a
be
very surprising fact.
It should not be used. With our busy lives and everything, we tend to see mothers, and there's no judgment about that. It's totally fine. I mean, you do need time to do home chores and everything, and you need a little bit of time for yourself so that there's a safe space for your baby and you can do the chores. And for that, what we use is called exercisers or the walkers or the jumpers that we put the baby in, and the baby's super happy in them, and it's a very cute thing to look at. Since the place where we put the baby is made out of cloth, it's not very stable for a baby, right? And that can cause hip dysplasia, or in the long run, hip dislocation and dysplasia. And that's why it's not recommended to use these things on a daily basis and for longer hours. Now, I do realize that sometimes you do need to put your baby in a safer environment so that you can do, take a shower, get some things done. That's understandable. But don't put your baby in those things for more than 15 to 30 minutes. When we put the babies in them, they usually don't know how to walk, and they're usually holding themselves like this with the thing. So it can cause problems here. And not just that, they're usually standing on their toes. Their muscles don't develop properly in the legs, and they start toe walking. And when they do that, they think that that's the normal way to walk. And that's why it's essential for the smooth development of the babies that we do not put them in things that rapidly makes them walk before they're ready to walk. And it's nice to have that 15 minutes of break, but at the same time, that can cause your baby long-term detrimental effects. So it's better to avoid it.
Correct. So basically, don't force your baby to do anything that is not for the age.
Yeah, exactly. It's just better to give them lots and lots of tummy time, lots and lots of, like play with them on the ground. It's just better to just have them on the ground, maybe have a play mat or something instead of in a machine that's going to cause long-term effects.
Yeah, so please don't.
Yeah. I have a very interesting next question for you, which is pap smears. It's recommended for everyone over the age of 25. And now I think the recommendations are changing for people age 21 as well, right?
Yes.
That they should start pap smears. And why do you think that's important? Why do we do pap smears at all?
So like you said, the age has been decreased. So every female from the age of 21 should start getting pap smears, and every 3 years. So why do we highly recommend that? Early detection is always the best in any form of thing, and pap smear is used in early detection of cervical cancer. Cervical cancer is one of the most aggressive cancers that can occur in females, right? So early detection is very important, and the most common factor that causes cervical cancer is the virus called HPV, and HPV is sexually transmitted. So any woman from the age of 21 should be recommended to take the pap smear every 3 years so that we can do early detection of the cancer. But pap smear doesn't help you to detect if the reason for the cancer is HPV. We have something called HPV co-testing, which is made compulsory for every woman from the age of 30. But if a woman less than age of 30 is detected with cervical cancer, then we do the co-testing, right? And from the age of 65, we stop doing the pap smear. Usually, women of age 65 are already post-menopause, right? If there is no previous positive pap smear test, then we stop doing the pap smear at the age of 65 to stop them from getting unnecessary procedures. And we keep 3 years as a limit because 3 years is the time when we can see a new generation of cells or any new form of infection that the patient has got. And we can do the test more often if a previous positive precancerous cell is detected, or if any form of complaint that comes in case of, for example, unnecessary bleeding seen or unnecessary pain seen, like which is suddenly new in the female. Then we can do the test more often to stop these kinds of pre-diagnosis or pre-infections as well.
Mhm.
Pap smear doesn't do very good job at detecting STDs though.
Mhm.
So for STDs, we have completely a different form of test,
Yeah.
which can, but it's usually to detect cancer, cervical cancer, which can be one of the most aggressive form of cancers.
Mhm.
So yeah, that's how it goes.
Yeah, so that's why it's recommended that everyone age 21 and above, you guys should do your pap smears, go to your doctors and start
Please.
testing for pap smears to detect early on if you have anything unusual or not.
Okay, let's come by this. So recently, my mom went to her family physician,
Mhm.
and they recommend her to take the flu shot.
Yeah.
And what do you have to tell about it? Why is it so necessary?
That's a very good question. And I took the flu shot actually yesterday. And why is it recommended for you to take the flu shot in the first place? Basically, flu shots are for what? It is basically for influenza virus, which is influenza A or B, and flu shots can work great for those. And every year, what can happen is that the virus changes. So, different strain of virus comes out, a new virus drops, and that's why you have to combat against it. Our body might have immunity for the previous strain, but for the newer one, we might not have immunity. And if there is a very strong strain and it accumulates in a population, it can even turn into a pandemic. That's why it's very important to vaccinate yourself and protect yourself and others as well. And the interesting part that a lot of patients know about is that as the influenza strain changes, people usually ask, well, if the influenza strain is changing, why should I take the same shot every year? The answer to that is because they change the shot as well. Every year, WHO and different organizations, CDC, they sit together and they take samples of strains from different parts of the world and they make a new vaccine that they think is going to be most prevalent the next year. And they make that flu shot and then they use that flu shot to vaccinate people next year. So it's basically an apprehension that they think that this strain is going to be the most prevalent next year and we need to protect the population against it. And that's why you should take the flu shot so that you can protect yourself and protect people around you from the very terrible flu season.
Wow. So would you recommend me taking it as well?
Of course, you should.
Okay.
Yeah, I took it too.
And just vaccines and me.
I know. It's not the most pleasant thing in the world, but you need to protect yourself.
I will then. I will for sure.
Okay. And this concludes our video, I think. Thank you so much, guys, for watching our video. And we're going to be coming up with more videos and more content for you guys. And in the meanwhile, I hope you enjoyed this one. And share it with your friends, like and subscribe to the channel. And we'll see you guys next time.